your mic. Thank you. So welcome everyone to our today's session. Kindly take a few minutes and introduce yourself on the chat box and welcome. So our today's session, ladies and gentlemen, the speakers, the Mama Siri and the champions of human rights, I am honored to welcome you to this groundbreaking webinar on the intersection of corruption and bodily autonomy of women with disabilities. We are here today, we come together to address the oppressing issue that affects the lives of many. We'll explore how corruption and power imbalances impact the bodily autonomy of women with disabilities. We always find that women with disabilities often face marginalization and suppression. Corruption worsens this injustice by targeting the vulnerable, and the vulnerable in this situation is a woman with disability. The stories that we hear today are testaments to resilience and courage. Today here we have Mama Siri, we have speakers who are working under different aspects of inclusion, and we're going to hear different stories that surrounds corruption. Throughout this webinar, we'll confront uncomfortable truths, challenge norms, and inspire action. Our esteemed speakers will guide us in examining how corruption robs these women of their agency and dignity. This isn't a platform for despair, or it's just a call to unite for change. We are not here to look for desperation and now start telling a story about your desperate situation, but we are here to have a call for a change. So the objectives of this meeting is to build an evidence on the linkages of corruption and its effects on the sexual reproductive health rights of women and girls with disabilities. That is going to be our guiding objective of this webinar. And we have some outlined outcomes that we want to achieve at the end of this webinar. One, the number of women with disabilities in Kenya exercising their fundamental freedoms and participating actively in the civic space and anti-corruption discourse increases. We want to make sure that at the end of this webinar, we have so many women with disabilities who are involved in the civic space and democracy and policy making processes in regards to bodily autonomy of women with disabilities. Another desired outcome that we have is cultural shifts and understanding of ableism and negative narratives on power, disability, and autonomy in women in Kenya. Another outcome that we desire is strengthened advocacy based on research and evidence generated on the effects of corruption on the sexual reproductive health and rights of women with disabilities in Kenya. So today, join us in this vital conversation. Let's commit to raising awareness and catalyzing real-world change. And together we'll build a more inclusive future where every woman, regardless of their abilities, enjoys full bodily autonomy and rights. Thank you for joining us in this journey towards justice and equality. So I welcome you once again on this session, and I hope we're going to have a wonderful, wonderful session to the intersection between corruption and bodily autonomy of women with disabilities. So I take it from here to Craig to take us through the process and thank everyone. So Craig, kindly take over.
Thank you. Thank you for that, Veronica. First of all, I take this opportunity to thank you all for creating time to come and join us. I am going to have a brief introduction about today and why today is a special day. As we all know, 28th September, well, if we might not be aware, 28th September is the day of action in support of the right to safe abortion. This day has been celebrated since 1990 in Latin America, and this day has been celebrated since 2011 around the rest of the modern world. In Kenya here, abortion is regulated by Article 26 of the Constitution of Kenya that states that abortion isn't illegal under the opinion of a trained health professional, or if there is need for emergency treatment, or in the life or health of the mother in danger. Specifically, the court's ruling affirmed that abortion care is a fundamental right under the Kenyan Constitution, and the arbitrary arrests and prosecution of patients and healthcare providers in this regard seeking is therefore illegal. Here at Disability Trust, we believe in safe, legal abortion, and we champion for a world in which everyone is free to make decisions about their own bodies and sexuality. Thank you. I'm now going to take this opportunity to welcome our guest speakers.
Craig, can I interject?
Yes, go ahead.
Sorry, this is Lizzie here. Before we welcome the speakers, can we briefly go through and ensure sign language is in place? The use of, that we're all familiar with the use of Zoom, reactions, use of the chat box for everyone else.
Yes.
Thanks.
Thank you. Thank you for that reminder, Lizzie. Are we all comfortable with Zoom? Can we all see the sign language interpreter? Question one, please.
Yeah.
Yes, we can see.
Yes.
Yeah.
Yeah. Thank you. Thank you for that, Cindy. Also, if you see here reactions, there's just next to share screen, there's a part where you can have a reaction. I've just issued a reaction. I don't know if you can see it on your end.
Yeah.
So that reaction can be used either to put up your hand or express your current emotion. If you put up your hand, then we'll be able to call you out. Is there any other need that someone how to mute, how to unmute, and start and stop camera? Are we all up to speed with that, please?
No, Greg, my camera is not working.
Who's this?
Rachel.
Is Rachel. Your camera is not working.
Yes.
Even after you click the camera button.
Well, it's just telling me to access camera on the Google setting, on the device setting.
Okay. Okay, we'll I'll get in touch with you shortly, and I know what the issue is. You need to grant your camera permission to access Zoom. Thank you. Any other challenges, please, before we kick off, that we're experiencing with Zoom that we may quickly remedy so that we all get the full experience? Please, if you do, you can put it in the chat box. If you want, you can reach out on the WhatsApp group. Yes, and I think I'll take this opportunity to begin. Please, I will remind you, if you do have a challenge, put it up on the chat box where all the introductions are taking place, or put it up on the WhatsApp group. We'll be able to respond to you immediately. Thank you. Any other requirements that one of us may have that we may address quickly before we start? Thank you. Thank you. Excellent. If there's none, allow us to proceed with the next item on the agenda. And that is our first question, addressed to our speakers, which is what is corruption and its impact on sexual and reproductive health rights? I'm going to post this question on the chat box so that you can all be privy to this and we can begin to answer it as we move on. Thank you. I will repeat the question. the first question for our speakers is, what is corruption and its impact on sexual and reproductive health rights? What is corruption and its impact on sexual and reproductive health rights? So yes, this is addressed specifically to speakers, and we may answer at will. Thank you.
Okay, good afternoon, everyone.
Good afternoon.
Good afternoon.
Hope you are all well. My name is Banis Care from Reproductive Health Network Kenya. And about corruption, corruption is an act of dishonest or fraudulent conduct by those in power, typically involving bribery. And about sexual corruption, it is the sexual extortion or a sexual form of corruption that refers to the abuse entrusted power through psychological rather than physical to obtain a sexual advantage or favor. Yeah.
Thank you for that. May we have
Yeah. Okay. Hi, everyone. My name is Mercy Wanjiko. And yeah, just like the previous speaker said, I think corruption refers to the misuse of power or authority, specifically for personal gain. And oftenly it involves bribery, embezzlement, and fraud. And specifically when it comes to women with disabilities, corruption manifests itself in very many forms. Especially on matters of healthcare, where people are exploited, they are sterilized forcefully. Government officials can even embezzle funds for the women with disabilities. So for me, corruption for women with disabilities, that's how it stands out for me. It's when a woman is denied a service or a fund that is supposed to benefit them, if they are not given. Yeah, thank you. And on matters of bodily autonomy, it's when a woman, especially women with disability, are faced with challenges which in regards to their bodily autonomy, they cannot be able to make decisions on matters of health on behalf of them. They are restricted to acquire information, especially on sexual health. Yeah, and even sometimes have faced medical procedures. Thank you.
Hi everyone. Can I go next?
Just hold for a second. I'd also so we also have presentations, and these are, because we're a bit tight on time. I would like to start off the presentations. The first one from Bijal Lal, please. Bijal Lal. Can you hear?
Hello.
Yes, we can hear you, Bijal.
Thank you. Like everyone said, I similarly feel that corruption is the abuse or misuse of power or authority for private gain.
Sorry, Bijal, let me interject.
I think it's very important for us to even define bodily autonomy because it's not a common term. I see. Sure.
I'm just wondering if everybody else can turn off their videos so that we can preserve the quality of the connection, because I can barely hear you. So if we can all turn off our videos and mute ourselves so that we can give you the full attention, I think that would be great. We can leave the sign language interpreter, of course, but the rest of us, please, let's turn off our videos and mute our mics. Thank you.
Thank you. I'm wondering, was I heard at all, or should I start all over again?
I couldn't hear you, so if you don't mind, please start. Thanks.
No worries. Thank you for letting me know, though. So as I said, like everyone said before me, corruption for me is similar, like the abuse or misuse of power that is entrusted on authority for private gain. And I think bodily autonomy is a term that might not even be familiar with everyone. So how I see bodily autonomy is the agency to make an informed decision about one's body. It can be about sexuality, sexual experiences, sexual choices, reproductive rights, if one wants to use contraception, access to abortion. It kind of is this umbrella term which all of this falls under. And we all experience bodily autonomy when we make decisions about who our body desires, if we want to get into sexual relationships, having kids. But I think violation of our bodily autonomy is when we are prevented to make decisions of our body, about our body. So if stigma dictates that women with disabilities or women with intellectual and developmental disabilities should not have kids, then one can be prevented from making that decision. Another form of kind of violation is when there are non-consensual acts carried out on our bodies. So forced sterilizations, forced abortions. So I think like knowing these two parts are also important for me when I try understanding bodily autonomy and my right to bodily autonomy. When I think about corruption, I think it is a very large kind of aspect or large part of our communities, and it affects all of us, directly or indirectly. I will be connecting corruption to the access of justice for women with intellectual and developmental disabilities in Tanzania. The women with disabilities who are survivors of sexual abuse. The argument I kind of am making right now is how can one access bodily autonomy when at every turn of accessing bodily autonomy or experiencing bodily autonomy, there are high probabilities of abuse and violence. There was a study conducted by ADD International in 2017 in Tanzania, which showed that 9 out of 10 girls or women with IDD reported experiencing sexual abuse in Tanzania. This in itself can be a whole webinar. But what was really important was the nuance that came that women with intellectual and developmental disabilities differentially experience their right to report sexual abuse, in part due to corruption. I know there is some background noise, so I'm just going to wait for it. Or am I audible still? All right.
This is yeah, go ahead, please. Go ahead. Thank you.
All right, thank you. So like I was saying, so I was around the point where women with IDD, so women with intellectual and developmental disabilities, differentially experience their right to report abuse, in part due to corruption. And the key barriers to accessing justice or reporting abuse were related to corruption in 3 ways. The first way was corruption at home level and the power dynamics at the home level. It was seen that support and interventions were limited if the perpetrator of the abuse was a primary caregiver. And corruption and abuse at the home level, which lead to unequal power dynamics, in turn led to a barrier for disabled people, especially women with disabilities, to report the violence. This was a more indirect form of corruption. The second, which is a more direct form of corruption, which someone mentioned already, bribery and corruption are commonplaces within our countries, and it has led to undisputed acquittals, which means that if someone was abused and this person, through the right channels, was in the midst of injustice, they were more easily let go because of bribery. And not only does bribery create or corruption create barriers to getting justice, it also leads to revenge violence. Once there are easy acquittals, those that are abusers are more likely to get out and repeat the violence on the same victim. The third form of impact that corruption made was lack of accessible reporting mechanisms, or the reporting mechanisms were made inaccessible due to corruption for women with disabilities, where authorities perceived mistrust in the accounts given by women with disabilities. So due to the person in power thinking that women with disabilities cannot testify or cannot give a good report, they were less likely to even register cases of women with disabilities. So the point I'm trying to make here is we are all affected by corruption, but research such as this shows and provides evidence of the multiple layers of oppressions that are perpetrated by the society using oppression on women with disabilities and especially women with IDD. And women with IDD are not only at higher risks of abuse, but due to corruption and abuse of power, they are also have no secure pathways to report to the forms of abuse. So that was the case I was trying to. If there are any questions, we can handle it at the end. Thank you.
Thank you for that presentation, Bilal. Yes, in the interest of time, I'd like to welcome Sally Gakur to make her presentation. Thank you.
Thank you. So I'm going to share the screen. Can you see everyone? Screen sharing. Okay.
Yes, we can see.
All right. So I'm going to start with the introduction of what disability is, and it is defined as a physical, sensory, intellectual, or mental impairment that affects a person's ability to fully participate in society. And again, corruption is, it refers to abuse of power for personal gain, often involving dishonest or unethical behavior. So it's not just monetary as most people would like to think. So we are going to explore how corruption can impact the ability of women with disabilities to exercise control over their bodies, what we are calling bodily autonomy. If we look at the challenges that women face with disabilities, it includes lack of accessible healthcare facilities, and they also tend to have limited accessibility of specialized services and discriminatory attitudes that they experience from healthcare givers. When it comes to the barriers that women with disabilities face, one of them is, of course, physical access. You find that most hospitals do not have the ramps or even the lifts, the elevators that can help them access these facilities. So they have to use staircases, which are not really easy for them to use. Another thing is discrimination. They get discriminated against and by healthcare providers and everyone else that come their way when they're trying to access these services, and also negative attitudes and stereotypes that hinder them making decisions on their own. Also with limited information, that they do not have this information that they need, because again, if they're not accessing healthcare providers and they're not accessing the services, then they tend to have limited information that will inform their decisions and exercising their bodily autonomy. What is the impact of corruption? Number one, corruption in itself can lead to misallocation of resources, as we all know. And that one can result in limited funding for accessible healthcare facilities and also support systems for these individuals. Additionally, it can perpetuate discriminatory practices like bribery. Of course, this is something that is general, because even the general population can go through this, but the women with disabilities are more prone. And lastly, corruption can contribute to lack of transparency and accountability in healthcare systems, making it difficult to address the specific needs and concerns of individuals with disabilities, women especially. And again, it also leads to misallocation of resources, like I had said. So you find that they cannot access specialized care or even equipments. Hindrance to bodily autonomy. How does this correlate? So limited access to accurate and comprehensive information about reproductive health and planning options. You find that these women are not well informed, and because of that, they cannot make decisions with whatever it is that they need to make. Another thing is that with corruption, like I said, it is not just monetary. It's about leaders making misinformed decisions, or just not
involving these people in making decisions. So you find that they will be sterilized. If someone, most of these women with a disability, most of them are prone to cesarean section, and as opposed to just going through the normal labor, and some of them will end up being sterilized during those procedures without them knowing. And that is a form of corruption in itself, because they have not even been involved in decision making and consent. So what solutions and advocacies do we have? That's why we have Disability as one of the organizations in Kenya that deals with advocacy. We need organizations that advocate for the rights and privileges and policy making. We need to enhance transparency and accountability. Transparency being that there is open and accessible information that enables individuals to make informed decisions. Accountability, putting these people who are at the senior positions accountable for their actions, and inclusive policies that promote equal opportunities and access for all, regardless of their background or abilities. And we need also to encourage collaboration between government, civil society, and disability right groups to foster open communication and mutual respect for women living with disabilities. Call for action. We need to inspire the audience that we have here, whether you're disabled or not, that you get to be active participant in sharing, helping people share stories, women with disabilities, or even those persons who know people living with disabilities, so that we can empower people out there. Also encourage the audience to get involved through volunteering, donating, and advocacy issues, and also provide resource provision such as websites and articles that advocate for women with disabilities, and encourage them to engage through social media platforms, media, or joint campaigns, and even engage their local leaders. Thank you, unless you have any questions.
Thank you for that. Thank you for that, Sally. Yes, please. Thank you. We'd like to invite our next, there'll be a session for question and answer at the end. In the interest of time, please save your questions, write them down. There'll be a session for a question and answer. So we would, in the interest of time, we would like to welcome our next panelist, and that is Mercy Wanjiku. Thank you. Mercy, are you present? Thank you. I can see. Mercy, for some reason we cannot hear you. Can you?
I think she's muted, no?
I think so too. Mercy, can you please click the unmute button, please?
Yeah, can you all hear me now?
Yes, we can. Thank you.
Okay. Let me share my screen again.
Why? We can't hear the presenter. What is wrong? We can't get the presenter.
Mercy, I think you have muted again. Kindly ensure that there's no X over your, there's no red line over your mute button, please. Thank you.
Hear me now?
Yes, we
Clarence,
can. Yes, we can hear you now.
Can you hear me? Can you, I think when I'm sharing my screen from this side, it's muting. I think I sent you my presentation. Can you be able to kindly assist me, share it from your side? Yeah, thank you. Yeah, so just like I said, like the previous speaker spoke about some of the barriers that corruption causes to women with disabilities. And in my presentation, I'm going to be talking about the multidimensional approach that addresses the barriers that prevent women with disabilities from enjoying their rights. And I'm going to, why it's multidimensional, it's a multidimensional approach. It's because it's talking about the structural, the systemic, and the individual barriers that prevent women with disabilities from enjoying their rights and autonomy. The second slide. Yeah. So on the my first point is protecting the rights of women with disabilities. I think it's a large time that we advocate for the legal policies and frameworks that that speak towards and protect the rights of women with disabilities. This includes their bodily autonomy. It's high time that women with disabilities are given the power and have policies that speak towards their bodily autonomy. They can be able to make decisions for the type of information they need for their sexual health. They can be able to make decisions for the type of family planning they will need, for the type of commodity or service in regards to sexual reproductive health they will need. We don't want a society where decisions are made on their behalf. And for this to happen, I think it's high time we came up with legal and policy frameworks that speak towards their needs. And we highly advocate for their policies and frameworks. And also, these policies and frameworks are going to hold perpetrators of corruption accountable. Those who embezzle funds that are meant for women with disabilities, healthcare providers who make decisions for women with disabilities. Yeah, it's the high time that we have such legal policy and frameworks. The second slide. Yes, on empowering women with disabilities, we can have sensitization sessions. It's high time we started doing capacity building and strengthening, education sessions, sensitizations, trainings, to be able to help them to get up and speak up for their rights, and to help them in making informed decisions in regards to their bodily autonomy and also in regards to their rights. Yeah, and the next slide. Yeah, and in regards to amplifying their voices and advocating for their rights, it's high time they strengthened their we have networks that we have consortiums, we have networks, and we have organizations like Disability that advocate for the rights of women, of adolescent girls and young women living with disabilities. I think it's high time they came up with consortiums or networks of even women living with disabilities for their voices to be heard, for their rights to be heard. and for their bodily autonomy to be respected, and for policies that speak towards their right and bodily autonomy to be put in place so that corruption, any form of corruption, that any form of corruption that is directed towards them is addressed. The next slide. Yeah, there is improving access to healthcare, I think, and the first thing is ensuring healthcare. There's healthcare accessibility in remote areas, in most remote areas, for especially for women with disabilities. We find that infrastructure towards the health facilities is very hard for women with disabilities. It's very hard for them to access healthcare facilities due to infrastructure. And you might find that maybe there are people who have been given funds just to facilitate the easy movement of women with disabilities from their homes to the health facilities. Funds are embezzled. This is why we want policies that are put in place so that women with disabilities can be able to access. There is good infrastructure for them to access healthcare services, and also there is, even in the healthcare facilities, there is healthcare providers who have been capacity strengthened and built on sign languages, on everything that's on sign languages, if it's Braille for people who are visually impaired, if it's sign language for people who have an hearing impairment. Yeah, they've been capacity built and capacity strengthened on that. We want disability-friendly healthcare facilities with disability-friendly healthcare providers, and also information to be accessible, if it is text to speech, if it is Braille, if it is sign language. Young women with disabilities can be able to access this information without any problems. And these are some of the things that are going to cut on corruption, and for especially on matters of women and their women with disabilities with their bodily autonomy. And then yes, just like I said, disability and gender sensitive healthcare training for professionals. We want health facilities that have that are disability friendly. The infrastructure, they can be able to access the health facilities well. The healthcare providers are disability friendly, and they understand on the sign language, on the Braille, on the text to speech, and everything that a woman with disability will require to access the highest and best form of quality standard healthcare. And the next slide. Yeah, including women with disability in decision-making processes. This is co-create is for women with disability. Sometimes we tend to make decisions for them without inquiring from them what they will need. I think it's high time that in decision-making spaces, women with disabilities are included right from the designing of a program to the implementation of programs, right from co-creating of solutions and programs that benefit and speak towards them and are able to address the challenges, especially in regards to their bodily autonomy, for them to easily access healthcare services and the rights to their bodily autonomy. And in decision-making processes which affect their lives, such as policies on healthcare, education, and employment. And also they should be included on matters of employment. I have seen organizations like FIDA, it does not, and many other organizations, it does not matter that what kind of disability you have, as long as you are giving the highest form of services like any other person. It's time we included women with disabilities in employment spaces, in big decision-making tables, be with them right from the co-creating of a solution, identifying of a problem, to the implementation of programs. Yeah, and the next slide. Yeah, then there is monitoring and support. Monitoring and reporting cases of corruption and discrimination against women with disabilities. I think maybe disability could tell us if they have toll-free numbers where such cases can be reported, where especially when women with disabilities, or I think it's time that we advocate for a toll-free, national toll-free number where we can be able to report cases of discrimination, and always ready to provide support and redress to victims, just like the way we usually see in matters of GBV. Like we have a response that is very fast. We want to have responsive mechanisms towards women with disabilities that are very fast and are going to be acted on upon being reported. On the next slide. Yeah, there is promoting diversity and inclusion. Promoting diversity and inclusion in all aspects of society to reduce stigma and discrimination against women with disabilities, and to enable them to fully participate and contribute to their communities. We should not discriminate women with disabilities. It's high time, and I love the fact that I'm speaking about a multidimensional aspect. It's high time that women with disabilities are in every engagement, because inclusion and diversity is very key, especially in identification of problems and implementation of programs. We cannot we have to listen. We have to really listen to what speaks to them, what policy speaks to them, what works for them, and through this we're going to promote diversity and inclusion, and also we are going to curb corruption that faces women with disability. Yeah, and in conclusion, the intersectionality of corruption and bodily autonomy for women with disability highlights the need for a comprehensive and multidimensional approach, just like I spoke about, in that it addresses all the barriers that prevent women with disabilities from enjoying their rights and autonomy. And this approach must be inclusive, participatory, and right-based, and must involve all stakeholders, including women with disabilities, their families, communities, civil societies, and government agencies, working together towards a common goal of promoting equality and the empowerment of all. And I think if we approach the barriers that face women with disabilities, and especially on matters of corruption in regards to their bodily autonomy, in a multi-dimensional way and in a multi-sectorial way, we are going to achieve our that sustainable development goal, which is gender equality, and especially for all women in all their diversities. And with that, thank you so much. In case of any questions, I will respond to them later. Thank you.
Thank you, Mercy. Thank you for that presentation. I'd also like to just quickly take this opportunity to run you through our lead program, that is Mama Siri. Some of us have interacted with it here, others have not. But it will take me 2 or 3 minutes just to explain what Mama Siri is and who she is. And also because today we're joined by Mama Siri on this call. So Mama Siri is our toll-free referral service on sexual and reproductive health rights and gender-based violence for women with disabilities by women with disabilities. The number is, I'll actually just put it here on the chat box. The number is 0800 000 300. It will be on the chat box. Yes, it's a toll-free number, and it is until now it is in 8 counties. That is Nairobi, Mombasa, Kisumu, Kajiado, Kilifi, Kwale, Kisumu, Uasin Gishu, and Kakamega. Yes. Up until now, Mama Siri has received just over 15,000 calls. Mama Siri is a little bit over 3 years old, started in 2020, and is active until now. Mama Siri works off a referral service where it is the sole function of Mama Siri is to provide referral services for women and girls with disabilities that call in. I think that's an overview. I would encourage questions on the chat box that we would have answered. And yes, we will be hearing from Mama Siri shortly. Asanteni. Thank you. I would also like to take this opportunity to invite our next panelist, Vilda Karibu. Thank you.
Hi everyone, kindly confirm if you can hear me.
Yes, we can.
Okay, my name is Vilda and Craig also. I request that if you could kindly share my presentation because I think I might have issues sharing on my phone. So basically, thank you so much. My name is Vilda Tieno. I'm from Kisumu County. I'm in the space of SRHR, which is something that I'm so passionate about. And as we talk about corruption, I'm very intentional to talk about corruption in regards to access to contraceptives among young girls and women with disabilities. Next, kindly. Okay, in the content, I developed, there was introduction, then we are going to talk about the barriers, then corruption risk factors, and then the mitigating factors that we can measure into, and then also the recommendation. Next. So as we talk about corruption, we realize that one of the things that is making access to contraceptives in our country is corruption. Why do you talk about corruption? As much as contraceptives and family planning are essential aspect of reproductive health and family well-being, and going with the SDG number 3, then we need to attain the highest standard of health, all of us. They involve various methods of strategies to help individuals and couples to make informed decisions. So informed decision meaning that I need to make decision when and when not to have children. I need to consent to everything, and basically it's in line with bodily autonomy. So in regards to that, all states must respect and protect the principle of non-discrimination, which is something that is very common when you talk about persons with disability, equality as well as bodily autonomy. And then integrity is so important, as and that is why we are talking about the corruption aspect in it. Next, kindly. So we realize corruption has distorted the provision of public goods, including healthcare, by draining resources from already existing healthcare budget and promoting insufficient allocation of resources. So basically, you can really tell this when you look at in our country, let me say the Kenyan context, where as much as we talk about budget processes in the country, then we realize an aspect of health is never so much a priority, which is for me, I'll feel that there's a very much gap when you talk about that. And also finding its own way that it's not being prioritized in the country. So for me, I think that when you talk about access to contraceptives, the other day that we are just having the International Contraceptives Day, where we are talking about people having choices to make when we talk about contraceptives, then now where do we draw the line? How that our girls and women, young girls, let me say girls and women with disability are not having easily access to these services. In a way, it infringes on their rights, and also not giving people options based on their different diversities. Next, kindly. So the existing barriers, we can talk about the intersection of disability and access to contraceptives, highlights unique challenges that persons with disability face. So these challenges, of course, we know, and every now and then we're seeing about them. or there is inaccessibility, then we also realize the legal framework. As women with disability, how do we identify with the legal frameworks that we have in the country? Then also accessibility. Do we really have information in the most accessible way in regards to our needs? For example, I'm looking at the information on the, I want to use a condom and I'm visually impaired. Does it really give everybody access to that information on how, what, and what should be used? Because even currently when I'm doing a youth-led research on access to contraceptives among young people with disabilities, then you're realizing, even as we talk about education and awareness, people don't have accessibility to this information. And then also in regards to that, people tend to question, and when you're going to access these services, quote in quote, somebody asking you, oh, kumbe wepi unatumia hizi vitu. So you realize that it's not something that is prioritized as much as every now and then we talk about inclusion, but do we really understand the aspect of inclusion that you're talking about when you talk about access to contraceptives and family planning services? Next, kindly. So globally, we realize that currently, like in the current decade, more women are using the modern contraceptives. But despite that, then we also have that the World Health Organization is reporting that there are so many, a huge number, a million of women who have who want to avoid pregnancy are not using modern contraceptives. In the end of it, of course, if you want to maybe avoid pregnancy, then it means you have to have options and choose from the options that you have. But in the end of it, then you realize that this is escalating issues like gender-based violence in the family. At the same time, it's also increasing cases of unsafe abortion. And we know very well that abortion is something that is really killing young people, is really killing women in the society. Then I'm looking at, do we have this data? Even when we have these cases, is there a leeway where people can just find these cases and just have the real data in regards to this? Because at the end of it, you need to back this information with data. So in regards to that, then how has corruption escalated to this number that we're having? Then for me, I'm seeing it in a way that little is being allocated when you talk about contraceptives, and that is in the sector of health where little is being allocated. And then also we have more of commodity stockouts. As much as we talk about there is access to contraceptives, you have choices, you can go and seek this service. And then you realize when you go to for these services, then you realize there is a commodity stockout. Whom now do we hold accountable? Is it me? Is it the government? Or whom do we hold accountable in regards to these cases? Next, kindly. So according to the World Health Organization, then we realize that its effective should be measured against core characteristics, which are 8. And then maybe if I just talk about the AAAQ, where you have to have the quality of these services, because from my finding, those still in the process of doing the research, then people still fear maybe accessing this contraceptive from the public facilities, because somebody is scared of the quality that he or she is going to get there. For example, you go for a service, but then you're not sure how the quality is it, or are you really sure that you're going to be protected from what you're trying to protect? Are you really sure that how accessible is these services, and does the coverage of all target patients? Do we really have discrimination where some people are being given these services? And for me, when I'm going to access such a service, then people have to question, like, will you really have a partner? Are you really having sex as a young person or just as a woman with disability? Because in our current era, disability and maybe having children is something that even some people take it to a niche of just celebrating in a way that it's considered not to be a very normal thing, despite the effectiveness that should be there and the measures that should be there. Then we still realize that access to contraceptives is not something that is very normal in the society when you talk about girls and young women with disabilities. Next kindly. So the role of corruption in hindering access to health services. When I talk about health services, basically I was referring to the access to contraceptive. And we have the embezzlement of funds where we have the little funds are being geared toward access to contraceptives in the society. Then we have, of course, bribery and extortion, and then supply chain mismanagement is also existing. And then there is also lack of accountability. Whom do we hold accountable when we have commodity stock out in the facilities, when young people are not accessing these services, maybe because of accessibility issues and maybe lack of information and awareness? Whom do we hold accountable when you talk about all this? Next, kindly. Yeah, and then also I think I talked about this at the end of it, as we talk about, maybe at some point we are talking about the triple threats, and then we realize as much as there's yes, there are contraceptives, but then corruption at some point hinders the access to contraceptives. So in line with that, there is an increase in safe abortion cases among girls and women with disabilities. And also today we are commemorating the World Safe Abortion Day. So do you really realize that when we don't give people options, when you don't give people services, then at the end of it we have deaths, and then also cases of young people, maybe we can say survivors of unsafe abortion. And also as much as we don't give people options, then from the research that I'm currently having, then you realize even people would go for the unsafe abortion, because we know that abortion is restricted in Kenya. So what do I do as a young person? I go through the other way around, going for the unsafe abortion, because that is the decision I've made as a young person, basically because nobody gave me choices, or I don't have access to the right information to make an informed choice of what I really want to do. And then secondly, under budgeting for health in Kenya. Currently, we know that the budget process is going on, and we started with the CIDP, just a simple one. But you realize in these spaces, young persons with disability, or rather also women with disability, are not on these public participations. At the end of it, for example, the last one that I attended, we were talking about, oh, we want a GBV center in the community. But being that this was a space full of people, I think, let me just say, lack of information, then somebody will just stand up and say, this one we leave to the police, they are going to work on it. And people in unison support that. And basically because people lack information, then people think that this is not something that should be prioritized, and what people are prioritizing maybe are any other things. But at the end of it, we realize that because we are not there to stand for the budget, we are just coming in and you're like, oh, there's nothing, there's less money in the health sector. But when we are called upon for this public participation and just giving up our mind, then people are not there. But I think also it's attributed by lack of information. Then you have also more cases of unmet needs, and also these are escalated to just going back to the cases of GBV that I talked about earlier. Next, kindly. So in regards to mitigating this, there was a thought that there should be healthcare system. There should be things like increasing accountability and improving management, and then also marginalization of the. There has also been marginalization in SRHR main target users, where people who are the target group are not getting the right information, and at some point they are still marginalized. So if you need to really mitigate this, then we also need to look at that. And then also just informed by the budget advocacy, where we can really work on this, because I think that this is one of the root causes of what you are talking about, and this is one of the root causes that we can be hold ourselves accountable by tracking what is going where, which money is being used for what purpose, and just knowing the whole process that is going on. Next, kindly. In the recommendation, so my recommendations are there should be training of girls and women with disability on the budget processes. for me, I see it as the background of everything, because we need to understand when we talk about access to contraceptives, then we realize that we also mandate the government to keep me safe, to help me keep myself healthy, and also to give me choices. So when girls and women with disability are trained on the budget processes, then I believe the cases of corruption at some point will go down, and we can have solutions from there. Then also capacity building of girls and women with disability on their rights to comprehensive access to health. Comprehensive access to health, where we talk about the bodily autonomy. And in regards to that, as much as we talk about contraceptives or family planning, then we realize we ourselves don't have this enough information. Maybe me and you who is on this platform, we get to have this information, but I believe like we can hold each other accountable so that we can have more girls and women with disability coming on board and just understanding what are my rights. When you want health services, what should I do and what should I not do, or how should I explain myself, or what should I do with regards to that. Then also better understanding of the different existing policies of the country in line with the access to sexual reproductive health and rights. For example, we have the adolescent and the young people policy, which was the validation. I think it was just cancelled the other day. But you see all these, for example, in that document, do we have the in that document? And how are we contributing so that we ensure that access to the contraceptive is something that is prioritized and something that is also being talked about. Generally, there exist a number of policies that are in line with literary need also to look into. And then maybe
Hey, Vilda is getting lost.
Can you hear me?
Can you just come again? Yeah.
Okay, so I don't know where I got lost, but I was talking on the recommendation on training of girls and women with disability on the budget processes, and I was thinking this is a very key thing when it's okay. I think it's the among the root causes of corruption, and just having a little access to contraceptives in the society. Then the second one, I was talking about capacity building of girls and women with disabilities on the right to comprehensive access to health. What do I mean by this? As much as we talk about access to health, access to contraceptive, having choices in the society, I feel that at some point we lack information. Me and you, we might have information here, but how many girls, how many women outside there who are women with disability do not have choices? And even we are having cases of just forced abortion without consent, without having choices to make a decision on what one feels that they want. And then also, a better understanding of the different existing policies in the country in line with access to SRHR. And I was just talking about the adolescent and youth young persons policy, which the validation, I think it was cancelled. And as much as this is our policy, then you realize, do this policy really address our issues? And why is it that when you have such policies, young people are not being involved? Because I think what led to this, like few people are being required in such validation, yet young people themselves have not been involved in such. And then I wanted to talk about a last point that I did not talk about in this slide was data. Everything we talk about, I think we need to support it by data. As we talk about accessibility, how many health facilities can we confirm are not accessible to persons with disability? When you talk about there's no access, when I'm going to access contraceptive services, I can't access the facility. How many facilities do we have like data to support? There's not this and there's not this. When you talk about even like young women with disability, I think at some point, yes, there are more numbers of unsafe deaths resulting from unsafe abortion, but then we realize this is never documented. So even if I talk about deaths from unsafe abortion, then where is my data coming from? Like who has done that research to find that young women are dying? Because these cases are not being documented, and being that abortion is restricted in the country, and yes, people will not come out easily to document their story or just talk about this in the society. Yes, so my last question to all of us, as we talk about sorry, before that, I'll talk about, as we look towards the recommendation, then we should look at an intersectional approach. It's not all about just a woman with disability, but there are so many other factors that might bring about this vulnerability. Apart from being a woman with disability, you might be from the rural areas. Religion might also be a factor, and many other things, ethnicity and any other things. So taking an intersectional approach to address corruption in regard to access to contraceptives is a very key thing. Lastly, I'll leave us with the question: when you talk about corruption in access to contraceptive, whom do we hold accountable? Is it me, or are we just putting the blame on someone, or how do we all contribute to this? Thank you so much. And in case of any question, I'll be there to answer. Thank you.
Thank you for that, Hilda. Yes, in the interest of time, Juma, please proceed with your presentation. I would like to remind our panelists that we are required to stick to the 8-minute rule in regards to time. Thank you.
Thank you so much, Craig. I'll be talking about, first of all, can everyone hear me?
Yes, we can.
Yes, we can.
I'll be talking about corruption and how it affects LGBTQ women and non-binary persons with disabilities. First of all, I'd like to look at the landscape in Kenya in regards to LGBTQ, and legally, homosexuality is criminalized in Kenya under the colonial era laws. Same-sex sexual activity is punishable up to 14 years in prison, and the legal environment has created a climate of discrimination and harassment against LGBTQ people, making it difficult for them to openly express their identities and advocate for their rights. Activism, despite the legal challenges, there has been a growing LGBTQ rights movement in Kenya. Activists and organizations have worked to raise awareness, challenge discrimination, and advocate for legal reforms. Organizations such as the National Gay Lesbian Human Rights Commission has been at the forefront in advocacy efforts, taking legal action to challenge these laws. In the healthcare and social services sector, LGBTQ individuals in Kenya have faced significant barriers in accessing healthcare services, including discrimination from healthcare providers. Although there are organizations such as the Gay and Lesbian Coalition of Kenya who have worked to promote LGBTQ-friendly healthcare services and support networks. So what is corruption? Corruption refers to the dishonest or unethical behavior of individuals or institutions in positions of power or authority, often involving the misuse of public resources for personal gain. Corruption can have significant impact on sexual and reproductive health rights services in several ways, such as resource diversion. You see, when funds allocated for selection programs are embezzled or misappropriated due to corruption, it can lead to lack of essential resources for services such as family planning, maternal health, and etc. And as you can see that persons with disabilities who identify as LGBTQ face a multiple layer of marginalization. It can cause to inequitable access to resources, to services. Those who can afford to bribe or pay under the table fees receiving better care, while the marginalized or the vulnerable population suffer from the inadequate services. It also affects the quality of care, where bribery and corruption in healthcare can lead to substandard care, as providers may prioritize financial gains over patient well-being, which can have serious consequences for the SRHR outcomes. There is also policy distortion. Corruption can influence the development of policies and regulations related to SRHR, potentially leading to the adoption of policies that prioritize the interests of corrupt individuals or organizations over the health and rights of individuals. There is also undermining accountability. Corrupt practices can undermine accountability mechanisms with healthcare systems, and it can be difficult to identify and address the issues related to SRHR violations or neglect. There's also stigmatization, which can perpetuate, corruption can perpetuate stigma and discrimination in SRHR services, as individuals may be coerced into paying bribes or feel ashamed to seek care due to the corrupt practices. Looking at the intersection of between corruption and the LGBTQ rights of women with disabilities, there is underrepresentation. There is limited representation and participation, where corruption can undermine the representation and participation of LGBTQ women with disabilities in decision-making processes. When corruption infiltrates political systems, it can perpetuate power imbalances and hinder the voices and perspectives of marginalized groups. This can result into policies that do not adequately address their rights and needs. Inequitable access to justice. Corruption within the justice system can undermine the rights of LGBTQ women with disabilities. They may face difficulties in accessing fair and impartial legal processes, as corrupt practices such as bribery or favoritism can obstruct their pursuit of justice. This can lead to further marginalization and denial of their rights. There is lack of inclusive policies. Corruption can hinder the development and implementation of inclusive policies and programs that address the specific needs and rights of LGBTQ women with disabilities. Resources should be allocated to support inclusive initiatives that may be misappropriated, resulting in inadequate support system and limited opportunities for empowerment.
A light reminder, we have 1 minute left. 1 minute left. Please wrap it.
Okay. I'm wrapping up. Looking at the civil society and how it addresses LGBTQ plus disability inclusion, we have advocacy and empowerment through training. We also have just a moment. Collaboration, where foster collaboration between the LGBTQ and disability organizations to work together on issues of common interest and research and data collection. Civil society can conduct research to gather data on the experiences and the needs of LGBTQ individuals with disabilities. This data can be used to inform policy and program development. Thank you so much.
Thank you, Juma. Thank you for the session. I would like to welcome Tracy, our second last panelist, and I would like to remind you we only have 8 minutes. We are also targeting a close time of 4 p.m. as opposed to our earlier
3:30 p.m. So please bear with us. We will keep time at 4 p.m. Thank you, and Karibu Tracy. Asante.
Hello, hi. Can you guys hear me?
Yes,
I
we
think
can.
for me, I've been having network issues, and I think after my presentation, it might actually not. I might not be able to listen fully for the. I had prepared something on leadership or governance, structural violence practices in relationship with women with disabilities, and how this affects bodily autonomy and how it fosters corruption. So basically, I wanted to share something that I've been reading, just a news update from Impact News, and this is it's from South Korea, and it has been reported yesterday that women in South Korea, all women in all their authenticity and in all their autonomy, are being blamed for choosing not to have children. And I have underlined the word choosing. And currently, the birth rate of South Korea is 0.78 per woman. And in 2020, the number of deaths in South Korea outnumbered the number of births. And when the current president of South Korea was asked on how they're planning to sort of mitigate the decline in birth rate, he said that it's because of feminism. The president blamed feminism for the low birth rates in South Korea. And mind you, the news has reported women are being blamed for choosing not to have children. And this is a progressive country. And right here now in Kenya, a developing country hoping to be a progressive country, women do not even have the right to choose their family planning options. They're facing, from the previous present speakers, I think you've heard there's a lot of corruption in regards to access to SRHR. You have heard about the structural barriers, especially for women with disabilities in regards to access to options of family planning. Because even right now, the legal capacity of women with disabilities in Kenya is questioned. And today is International Day for Safe Abortion. And I'm thinking, since we are going up to Sakumi, you'll get to hear lived experience about how it's very difficult, about how women with disabilities face compounded inequalities, how they face, how they have experienced. Their trauma is very intersectional and complex at the same time. And at a structural level, at a leadership level, at a governance level, their legal capacity to choose the option of safe abortion for a woman living with disability in Kenya is difficult, while we have a country, a developed country, that at the current moment, is questioning the right of women to choose their family planning option. And the head of the state of that country is blaming feminism, an option that we are looking at right now in our country to help secure justice, equality, and equity for our women, especially women with disabilities. So with that, I would like to begin and say that for the past 50 years, leadership and governance in Kenya has been for survival, recuperation, and weirdly enough, for Kenyan self-reliance or self-governance. And within this metric, we have failed ourselves, our citizens, our future children, our women. And I think it is time we talk about rerouting our principles, virtues in regards to governance, leadership in all sectors of production and living in Kenya. I feel like, this is my own opinion, I feel like even if we keep on hustling to change our leadership, to change how we implement programs, how we include with the structures that we have right now for leadership and governance, we are not going to actually achieve inclusion, especially for women with disabilities. We are not going to actually achieve equity. We are not going to achieve dignified lives for everyone. We will achieve at a certain percentage, even at a 70%, but women with disabilities will be at the lower level of that dignified life because complexities. We live in a complex environment, and we
have 1 minute left. Thank you. Please wrap up.
We cannot achieve equality, inclusion for everyone with the kind of structures that we have in our governance and in our leadership. So the question that I have for everyone here is, what values should the 21st century African leaders hold? Because democracy is at stake, actual democracy. People have migrated to other regions to achieve their dreams, dignity, representation, belonging, inclusion. But as we can see, a new era is coming in, an era where it needs to be African-led. So everyone is a leader in their own merit, in their own environment. And our feminists, Afrofeminist, decolonization, Pan-African, kinship, evolution, revolution, One Health concept, perspectives, critical. Are they needed? Are these perspectives critical, or are they needed to build connections between, among, around siloed approaches in leadership and governance to be able to respond to crises and to be able to fully implement dignified projects and programs to realize dignified lives and existence for everyone, especially women with disabilities? That's it from me. Thank you.
Thank you so much, Tracy. Thank you so much, Tracy. We'd like to welcome our last panelist, Bernice. Please go ahead. Thank you. And remember, we have 8 minutes. Remember, we have a target time of 4 p.m. Thank you. Proceed.
Okay, for the interest of time, I will be short and clear. Actually, I'll begin with what is corruption. Like from the beginning, you've been saying corruption is an act of dishonest or fraudulent act by those in power, typically involving bribery. So sexual corruption is the sexual form of corruption that refers to the abuse and trusted power through psychological rather than physical to obtain a sexual advantage or favor. And bodily autonomy means my body is for me and my body is for my own. And it's about power, agency, choice, dignity, and formation of gender inequality. On impacts of SRHR matters, corruption, violence on the victims creates fear, and also women with high risk sexual behaviors have sexual reproductive health concerns, including unwanted pregnancy, abortions, and STIs. In addition, there are types of violence and threats against women: intimidation, objectification, and stigma, and unresponsiveness of counseling centers. Patriarchy, culture, gender, and inequality were observed in these women. And effects of corruption on SRHR. It increases safe abortion among girls and women with disabilities. Also, to add on that, there is also under budgeting for health services in Kenya, and also cases of unmet needs of access to contraceptives. On to my challenges in accessing sexual reproductive health services by women with disability. We have poor physical accessibility, whereby there are lack of ramps and in the hospitals. Also, we have negative attitudes by the sexual health workers, and long queues at the health facilities, whereby the women with disability aren't given first priority on matters their reproductive health. Also, we have high cost of services and the fact that the health workers are not experienced to handle persons with disability. It also creates fear for women with disabilities because they are not well conversant with the sexual reproductive health of the patient. Also, accessibility issues at the health facility, whereby we lack ramps and disability-friendly beds in case of delivery or admission of the patient who is a woman with disability. And to my last topic, exploring relationship between corruption and the rights of women with disabilities. Point one is persons with disability are severely affected by corruption. This corruption creates discrimination against women with disability, hence lowering their self-esteem. It also appears that persons with disability are exposed to abuse by those who provide care to them. Like we have the caregivers who cause discrimination among the persons with disability because, like we said, my body is my own choice. Yeah. Again, on exploring the civil society to address the disability inclusion, one is through increasing disability representation and leadership on social media platforms. Also, make health centers inclusive by having a sign interpreter and use of ramps. Also, design accessible communities. We should be creating sensitization in the community whereby we educate them on matters and how to handle persons with disability when they have emerging cases on matters of their sexual reproductive health. Also, we should ensure that health centers have ramps and lifts and they are disability friendly and have disability friendly beds. That's all from me. Thank you.
Thank you, Bernice, for keeping time. That is much appreciated. And that brings us to a close for our speakers. I would like to welcome our Mama series from each county to speak about their lived realities in regards to the subject matter. So I will actually, without wasting any more time, I would like to call Regina Chumba. Regina Chumba is our Mama Siri Wasingishu. Please go ahead. Just a small reminder that every Mama Siri has exactly 2 minutes. It is my job to remind you, and I will remind you. Oh, thank you. Please proceed.
Thank you so much. Good afternoon, everyone. I'll go straight to my presentation. Actually, first, I want to thank the presenters, and I would just request them that whenever we are presenting anything used for women with disabilities, let's just say women with disability. We don't live with disabilities. And let me just, I'll mention 3 things. I mean, the case studies. That's one, in Uasin Gishu County, because of corruption, as you've mentioned, it is diverse, it has a lot of complexities, that in Uasin Gishu, we don't have a representation of persons with disability, and especially women with disability in the county assembly. Why? Because of corruption. 2, I have a case that I've been handling, and what we do as Mama Series, we do referrals, and there's a case that I've been referring, and the mama, the victim, Mudhulumiwa, was willing to be paid off ili baada ya kudhulumiwa for a length of time, but because of corruption, she gave in. Another case study is is a case of a child, whereas she was defiled, and the mother was willing to be given money for the justice of this small girl not to be rich. Thank you, and God bless us all.
Asante sana Regina.
Correct, nimesikika?
Umesikika vizuri sana. Asante sana Regina. Naomba tafadhali kama uko na kelele background, tafadhali weka mute. Ningependa kualika Tohida Salim, Mama Siri Kwale, kutueleza mambo ya lived realities, yani experience. Asanteni sana. Kumbuka uko na dakika 2. Asante. Karibu.
Sidhani kama Tauhida yuko hapa, simuoni.
Okay, tukingoja Tauhida tutaendelea na Josephine. Tafadhali dakika 2. Josephine, ni Mama Siri Kajiado. Josephine Shao, tafadhali endelea. Karibu. Josephine, upo? Tafadhali naomba utoe mute.
Hello. Hello, mnanisikia? Hello.
Nakusikia Josephine.
Okay. Mimi ni Josephine Leshao, Mama Siri, Kajiado County. Kajiado County tuko na challenge ya wamama walemavu na wasichana walemavu, kwa sababu tukijaribu kuenda kupeleka hiyo kesi mbele, kama umepata mwathiriwa, hiyo kesi unaipitisha kwa chief mara ya kwanza. Ukitoka kwa chief unaenda kwa desk ya huko polisi, hiyo desk ya maneno ya violence ama maneno ya waathiriwa. Ukijaribu kufika huko unaandikiwa na unaambiwa hiyo kesi tutafuatilia. Hiyo kufuatilia inaenda hivyo mpaka kesi inapotea, mpaka mama mlemavu amekuwa chini, kwa sababu hakuna haki inatendeka kwa mama mlemavu ama msichana mlemavu. Walemavu wakidhulumiwa, wazazi hawajui waende wapi. Kama mimi Mama Siri nikiingilia kati, unakuta jamii haituruhusu sana Mama Siri ama mumama akuwe na sauti kwa jamii. So inakuwa ni shida kubwa huko mashinani. Hata hospitalini ukipeleka mtu mwenye ameathiriwa, madaktari wetu kama wangeweza kufunzwa, wengine wakienda hiyo training ya udaktari, wafunzwe, waambiwe mlemavu akija unamtreat hivi na hivi. Lakini wengi wao unakuta ukifika hospitali daktari ndiye anatangulia kumcharge. Kwa nini umepata mimba? Kwa nini vile uko na mimba na vile uko mlemavu utazaa aje? Inajua inakuwa ni maneno sana sana ya ufisadi. Kuta mwenye ameathiri mlemavu anapo, imekuwa challenge kubwa. Tunaomba tu washirika wenye wanashiriki katika women with disability ama disability as a whole waweze kuingilia, ndio wamama waweze kusaidika huko mashinani. Asante.
Asante sana Josephine, asante. Tungependa kualika Florence Hare. Mama Florence, ni Mama Siri Mombasa. Tafadhali karibu. Thank you. Mama Florence, upo? Mama Siri Mombasa.
Halo, hamjambo?
Jambo.
Mimi nasema katika hiyo shida kubwa ambayo tunaipata Mombasa, hiyo challenge ni sababu ya umaskini. Mwanamke mlemavu hana pato, ndio sababu napata hata kama ni upande wa hizi kesi zetu ambazo tuko nazo upande wa CGBV kushinda ni ngumu, kwa sababu kesi ikiwa uko na kesi mpaka huo na wakili ni pesa. Na ukiangalia katika hizi tunaita muhuri, hata kama tunaambiwa muhuri tunaweza enda, lakini muhuri nayo si bure. Ndio naona tunaumia sana. Mwanamke mlemavu mambo yake hayaendi sawa. Ingekuwa inawezekana kama tunaweza kama tutakuwa na wakili ambaye atakuwa anaweza kusimamia, ingekuwa vizuri, lakini hatufaulu mambo mengi kwa sababu kuwa hatuna wakili ambaye anaweza kusimamia, kwa sababu huwezi kupata wakili bila pesa. Ndio napata hiyo shida tunaipata sana kwa mambo mengi mwanamke mlemavu. Na kama hayo yatatengenezwa, basi kutakuwa kuzuri kwa mwanamke mlemavu naye kufaulu. Utapata hata wakati mwingine kupigwa ni sababu ya ile hawezi kwenda mahali popote kwa sababu hana uwezo. Ni hayo tu, asanteni.
Asante sana, asante sana. ningependa kualika Mama Anet Shivachi, Mama Siri Kakamega. Karibu.
Asante. Mi nami ningependa sana kukubaliana na presenters wetu wa siku ya leo ya kwamba hakika maisha ya mwanamke mlemavu anapotaka kuendea huduma za afya ya uzazi zinakuwa ni za gharama ya juu, kwa sababu ukiangalia kuna hospitali ambazo zinalipiwa na kuna hospitali ambazo hazilipiwi. Unapata ile hospitali ambayo hailipiwi haipeani hizi huduma. So you find unapata huyu mama mlemavu ndio atoke aende katika ile facility ambayo inapeana hizi huduma kwa hiyo gharama ambayo atawezewa kupata. Unapata kuna wengine ambao wanapeana zaidi ya kile ambacho kinahitajika. Unapata mwanamke mlemavu sasa hapati huduma vile inastahilika kutoka kwa wahudumu wa afya. So kiasi wanatengwa kwa sababu hela zao ni kidogo. Hela zao licha ya kwamba wamewezewa kupata ile ambayo inastahilika, kwa sababu hawawezi peana zaidi. Unapata mhuduma wa afya atamjali yule ambaye anapeana zaidi na anapata huduma ambaye inastahilika. Ningekubaliana na hao presenters wetu ya kwamba hakika inakuwa ni ngumu sana mwanamke mlemavu kuchagua huduma ya afya ya uzazi ambayo anaitaka. Unapata wachache ambao wamepata nafasi ya kuwa katika ndoa, mama mkwe ndio wa kusema aina ya method ambayo atatumia. So unapata hapo kiasi kuna corruption. Kuna corruption kwa sababu huyu mwanamke mlemavu amenyimwa haki ya kuchagua ile aina ya huduma ambayo anaitaka. Pia sasa unapata ya kwamba hizi hospitali ambazo labda mwanamke mlemavu anaweza kuendea hazina commodities. Hizi commodities zinagawa pia kulingana na jinsi watu walivyopiga kura. Unapata inaleta corruption kwa huduma za afya na inaathiri mwanamke ambaye anaishi na ulemavu, kwa sababu hatafikia hizo facilities ambazo ziko na commodities. Unapata ni ngumu sana, kwa sababu hata kuenda kujifungulia hospitali wengi wanachelewa, wengi hata waendi hizi kliniki kwa sababu hizi facilities ziko mbalimbali na pia hizo huduma ziko mbalimbali, zinapatikana katika vituo za afya ambavyo ziko mbali na wao. So ningependa sana kukubaliana na presenters wetu wa siku ya leo, na imekuwa mzuri. Pia embezzlement of funds, pia hiyo ni ukweli, ndio inafanya hizi commodities zinafikia facilities zingine na zinakosa kuenda kwingine. Asante sana.
Asante sana Mama Siri Kakamega. Ningependa kukaribisha Mama Hilda Mzungu, Mama Siri Kilifi. Tafadhali dakika 2 tueleze. Asante. Mama Hilda Mzungu, Mama Siri Kilifi, tafadhali karibu. Mama Hilda, hakikisha umetoa mute kwa Zoom pale. Tafadhali. Mama Hilda
yuko.
Okay, sawa. Tutaenda kwa Mama Rachel. Rachel afundi, Mama Siri Nairobi. Tafadhali endelea. 2 minutes. Asante. Rachel, Mama Siri Nairobi. Rachel afundi, tafadhali. You have 2 minutes. Lastly nitaita Mama Tauhida tena mara ya mwisho. Mama Siri Kwale, tafadhali kama unaweza endelea. Mama Hilda.
Asante. Na shida. Kwa upande wangu hususan huku Kwale County, hizo corruption ni nyingi kwa wamama ambao wana ulemavu. Na kama alivyosema msemaji mama Wane, hospitalini sana inaendelea hiyo issue ya corruption, kwa sababu unapata mlemavu hususan hawa deaf anaenda pale, hapana sign language interpreter, kwa hiyo wanatake advantage. Msichana ameenda ama mama anataka pengine family planning ya pills, wao yule aliyemleta anamuamulia, na pengine pia kuna kitu anapeana, sio pengine, yani ni ndivyo hali halisi ilivyo. Kuna vitu ambavyo huwa wanapeana ili afanyiwe tu, ili mradi tu akute amewekewa hiyo ni ya family planning, lakini ile hali halisi si kitu ambacho wamependelea. Vile vile katika nyanjani kwetu, wengi wanaodhulumika, wanaofanyiwa corruption ni wanawake ambao wana ulemavu. Wanawake hao huchukua, wanatake advantage kwamba huyu ni mlemavu, kwa hiyo anamtumia yule msichana, either pengine anamsaidia kama kitu kama funds, anajaribu kumchukua kwa video ili kisha anamtangaza mtandaoni, yeye anatengeza maslahi yake, kwa sababu kila atakayeona vile atakuwa na imani huyu mama mlemavu pengine amezaa. Wajua tunazalishwa hapa kwa hapa, kwa sababu hatujui njia za family planning. Ni kama hao deaf wanazalishwa, pengine leo mwaka huu unamuona na mtoto, next year na mwingine. Wanachukua hiyo advantage, wanamweka kwa mtandao, huyu ni mlemavu na ana watoto, anachangiwa pesa. Hizo pesa hazimfikii mhusika, zinaishilia hapo katikati. Huduma ya afya amekosa, maslahi yake ya kimaisha pia yanakosekana. Mimi naona kwa hapo leo ningependa kusimama hapo.
Asante Mama Siri Kwale, and finally Mama Siri Kisumu Benta, karibu.
Asanteni sana. Mi ningependa tu kuongelea juu ya, nimesikia presenters wameongea vizuri, but then my concern is about the issue of some of the terms that we use, because many of them have had talk about persons living with the disabilities. I believe we don't live with the disabilities, but disabilities is with us. So some of the terms we are using ought to be very straight. Then when we talk about improving access to healthcare, and then the policies, who are the people who should be compelled? Because I've heard even some of the Mama series saying that some of the facilities are not disability friendly, they're not accessible. But then who are the people who should be compelled? Because some of the buildings we see they're being put in place even right now, some of them are not disability friendly, but then still the government does not do anything about it. When we talk about disability friendly service providers, then what do we mean? Does it mean that these people are taken for trainings, or because I believe for one to be actually disability friendly person, actually it's a passion. Because you cannot take somebody for a training and then start telling that person that, you know, you have to love persons with the disabilities and things like that. It's a passion which somebody has. But then if somebody is a provider and the person already has attitude, that's why you had our presenter Vilda saying that at times when you go for family planning, then somebody asks you that, are you also using this? When you unatumia hii? Why? Because don't they believe, are persons, women with a disability, lesser persons? Because I believe the same things that the regular woman does are the same thing that even a woman with a disability will do when it comes to sexual reproductive health. Then when we talk about equal opportunities, is it really realistic? Because we've even seen the positions, even the opportunities which are there for persons or even women with the disabilities are being grabbed, but then people are just silent about them. So when we talk about equal opportunities, then there is much which should be done, and we should actually look for what is ours actually. Then when we talk about empowering women with the disabilities and even training them so that they get to understand their rights. Actually, this is a good one because people ought to understand what is actually their rights so that they're not being, because we realize that some people, because they realize that you do not understand or you do not even know your rights, that's why they violate you, knowing so well that you don't know that this is your right, and they go ahead and violate your rights. Thank you so much.
Thank you so much, Benta, Mama Siri Kisumu, asante sana. I would like to appeal to Mama Siri Nairobi, Rachel. One more chance, tafadhali, 2 minutes, endelea.
Habari zenu. Kwa majina naitwa Rachel Afundi kutoka Nairobi. I'm representing Nairobi na ningependa kuongelelea changamoto ambazo tunapitia Nairobi. Ni kuwa tukipata mwanamke mlemavu ambaye ako na mtoto ama caregiver ambaye ako na mtoto msichana ambaye ako na ulemavu, tunawapata wanakuwa na hizo changamoto wakienda hospitali, and they are not even accessing these facilities vizuri, na pia wakihudumiwa hawapati proper information to what they are supposed to be undergoing. And then tukifika pande ya polisi ama cases GBV, tunaona chiefs pia wanakatizia, ukienda kureport hawashughuliki. So Nairobi, I went to National Council, nikaongea na National Council. I was given a legal officer na akaniambia in case I get a case that is not being taken care of, I should just refer it to National Council, to the legal officers. Na pia ikafika pia kwa education, tunawapata hawapelekwi shuleni hawa wasichana, and they end up being wanakuwa kama ndio wanakuwa kama kitega uchumi kwa familia, of which hatutaki, ama anakuwa deported to a place aenda akafanya kazi. Na hizo pia cases ndizo tuna report sana sana. Na pia ningependa kushukuru kwa au representatives wetu wametuonyesha kuwa it's very true what we are going through and how we can go about to solve the problems within our communities. Thank you.
Asante sana. Ningependa kualika invite my reactions for 2 or 3 minutes before we have our founding and managing trustee Lizzie Kiama give us next steps and closing remarks. Tafadhali maoni, opinions, suggestions, thoughts, anything you may want, please. I open the floor for you. Thank you. Please, opinions, any ideas, suggestions you may have.
Craig.
Hey.
Jambo.
Mama Hilda. Karibu.
Asante. Mimi basi hata nasikia sina amani kabisa.
Asante.
Nashukuru, lakini nimeweza kuingia hata kama ni kuchelewa, lakini nishaingia.
Umesikia venye tumekuwa tukienda na Mama Siri, Mama Hilda?
Mimi ningesema hivi kuhusu wanawake ambao wanakoseshwa uhuru, hawana uhuru uhuru wa mwili. Yani mwanamke mlemavu anataka ajiamulie yeye mwenyewe vile ambavyo anaweza kufanya. Kwa mfano kama mimi, nitajiongelea mimi wakati nilipokuwa nimezaa watoto, nilizaa watoto watatu. Sasa yule watatu nikawa sasa nataka nifanye operation, nikakataa. Daktari akaniambia basi wewe kama hutafanya operation ukafungwa kizazi, basi wewe utakufa. Sasa mimi nikaomba Mungu, nikasema, maana wale watatu walikuwa ni vijana. Sasa mimi lengo langu nilikuwa nahitaji msichana. Basi nilikaa hivyo. Sasa nilipokaa yule mtoto yule watatu nilipozaa, sasa nikakaa. Baada ya hapo sasa nikashika mimba tena ya huyo mtoto. lakini Wagiriama kusema ule ukweli, ukiwa umeolewa na Wagiriama wa Mijikenda hawataki wewe utumie family planning. Mimi nilikuwa nafanya kujibaiba hizo family planning na vile ambavyo nilivyo. Mimi siwezi, ni mlemavu tena mzee, anataka nizae watoto wengi. Sasa mimi nikasema mimi nikipata huyo msichana nitafungwa. Mungu akanisaidia nikapata yule mtoto wa kisichana. Nilipozaa huyo msichana nikaenda nikafungwa kizazi. Sasa mimi nikamdanganya yule mwenzangu, nikamwambia basi mimi nilikuwa nasumbuliwa na tumbo, lakini sasa nimefungwa mshipa. Yeye akasema, wewe hata usiseme kuwa unasumbuliwa na tumbo. Wewe nimewaambiwa na marafiki zangu kuwa wewe umefunga kizazi. Kwa hivyo mimi hata sina haja na wewe tena. Lakini sasa mimi mwanamke ni awe na uhuru wa kujiamulia mwenyewe. Maana kuna wengine, hata kuna walemavu wasichana ambao mtu akizaa mtoto mlemavu anataka yule mtoto, anaona anasema akiolewa, yani hataki aolewe kwa sababu yeye ni mlemavu. Lakini sasa mwenyewe mpaka ajiamulie yeye mwenyewe. Kama kwa mfano kama mimi nilikuwa, babangu aliniambia mimi huyo mtoto wangu akiwa msichana mimi sitaki aolewe, maana amenipatia shida nyingi sana. Maana nilikuwa mimi ni mgonjwa kutoka utotoni. Ulemavu basi niliupata tangu ni mchanga. Sasa basi ndio akaniambia babangu, akasema huyu mwanangu hataolewa huyu. Lakini alipokuwa ameniona nishakuwa msichana, wavulana wanakuja, si alikubali, akachukua mahari. Unaona, sasa wanawake hawapewi uhuru kwa sababu wanafungwa na nino na wazazi wao. Unaona, kimila wanafungwa kabisa. Yani wanasema huyu mtoto wangu akiolewa atakwenda pata shida, hataolewa. Lakini mwache awe huru, ajiamulie yeye mwenyewe. Wengine wakizaliwa kama amezaa msichana mlemavu, anampeleka kwa daktari aende akafungwe kizazi. Hata yeye mwenyewe hajajua, haelewi. Anampeleka kwa madaktari aende akafungwe, maana anaona akizaa atamzalia walemavu wengine, watajaa kwenye nyumba. Kwa hivyo hayo ndio ambayo tunayapitia na tunayaona katika kwanza, na haya mambo ya haya huu ufisadi nao pia umekita mizizi. Kwa mfano mimi kama mama wa Kilifi County, tuliahidiwa ya kwamba tukaambiwa tutajengewa holi ambao walemavu wote watafanya biashara. Hai, miaka imeenda, hata ikaja 10 imeenda, hakuna biashara yoyote. Wafadhili pengine wanapeana pesa za wafadhili, walemavu hatuoni, walemavu wanadhulumiwa. Kwa hivyo ni mengi ambayo katika Kilifi County ambayo tunayapitia, mengi ya dhulma ambazo hata mtu hawezi kupata haki yake. Lakini tunashukuru hii disability imefanya hata wengi tutakuwa tukisimama kwa ajili ya hatutaki tena kudhulumiwa. Maana hata ukiingia kwa maofisi mtu hata hizi ni nino hii inua jamii, unaambiwa, unasikia wengine wanapiga simu wanasema ya kwamba mimi basi nimeambiwa nitoe pesa ndio niandikishwe. Unaona, si ni ufisadi huo? Pesa, walemavu wengi walemavu wasichana na wamama wakati wa kujifungua wanapata shida, vitanda hawaletewi vitanda vya walemavu. Wengi wanazaa chini, wanajifungulia chini kwa sababu hawanunuliwi vitanda ambavyo walemavu vitawasaidia. Kwa hivyo mimi yangu ni hayo. Asanteni.
Sana Mama Hilda, asante sana. Asante sana Mama Hilda. Lizzie, please proceed. Asante. Karibu. Thank you. Our managing trustee and founder.
Asante. Lakini naona kuna mikono imeinuliwa. Benta Chelagat, hatuja kusikia, pengine unaweza kuendelea.
Thank you, Lizzie. I wanted to talk about data. What can we do to collect data? Because the fact that we're generalizing it, it makes it complicated because of the programs that we roll out. Because some programs can do well in Nairobi County, some programs can do well in Mombasa County, Uasin Gishu, Kakamega, and how best can we have data so that we may have clear impact and assess of the abuse. Thank you.
Thank you, Chelagat. Benta? Your hand is up, Benta.
Benta Bella, if you have anything to say, please, your hand is up. Proceed.
Maybe it was put up in error?
Yes, I think it was in error. Let us assume it was in error. Thank you.
It's not an error.
Okay, please go ahead.
Can you get me?
Yes, we can hear you.
Yeah, what I'm saying is this. When you talk about I also wanted to address the issue of data. When we talk about data, then I believe, or I think we should also go further and even segregate the data, because when we talk about data, then we take it all summary, then actually it doesn't bring the clear picture also, because we have to know how many, for example, let's say, for example, if we have persons with disabilities who are going to maybe take pills or implants, then we should integrate so that we know how many deaf, how many physically challenged and things like that, then it should help. Then another thing is that issue ya kujihurumia. You know, at times it's us as persons with disabilities who make at times people think maybe negatively about us, because tunajihurumia sana mpaka somebody thinks you cannot make your own choices, you cannot make your own decisions. Thank you.
Thank you. Thank you very much, Benta. Any other reactions, comments, questions for the speakers? I know we've gone beyond time, but I feel like this is an important space, so we can afford to extend a little. Any other comments? Kuna mawazo mengine yoyote pengine au maswali?
Hello, afternoon. Mama Siri, Nairobi. I want to ask if we can be given that support, especially at the chief and the police station, for these people at least, especially kwa hiyo desk ya GBV, wawe wanaelewa kuwa hawa watu ni watu pia tunakuwa na polepole ya kufikiria ya maneno na mawazo. So they should be even given that session, at least to understand that this a person with disability, should be given time so that anaweza jieleza vizuri ndio kesi iweze kufika mbele. Na hizo cases, at least even they should collect data on how many GBV cases come on women with disability, because they increase each and every day. Thank you.
Thank you, Rachel.
Alafu mimi nitasema hivi Mombasa. Nasema hivi kulingana na ile ya jana nilikuwa nayo kwa chifu, alisema hivi kwa upande wa wale ambao wana watoto, upande wa hii Inua Jamii, kama uko na mtoto una hiyo una uwezo wa kuandikishwa kama ni mwanamke mlemavu ambaye yuko na watoto, anaenda na birth certificate, lakini si wengine ambao kama una mtoto huwezi kuandikishwa kama unatembea mwenyewe. Hilo tayari pia ni swali lingine. Alafu lingine tena kulingana kama huyu dada vile ameongea, huyu wa Nairobi, mambo mengi sana ambayo tunasumbuka nayo ni kulingana na hizi vitu. Kama tungekuwa tunapatiwa nafasi kama hawa machifu, kama wangekuwa nafasi ya kuwa tunaweza kwenda kwao. Sababu ile jana nilikuwa na sauti ya mwanamke, kile aliongea, sisi wanawake walemavu na sisi wenyewe tuwe na nguvu ya kujitokezea. Kitu ambayo inatusumbua ni uwezo wa kuwa hatuna chochote, lakini hata kule kwa hospitali tuna sauti za kuongea. Kila nashukuru sahii kuna ile kesi ya mtu wangu ambayo nilikuwa nayo, manake sahii atakuwa ndani, amehukumiwa 10 years. Hiyo nimeshukuru Mungu sana, kwa sababu alikuwa ameenda kumshikia panga amuue, lakini hiyo nimeshukuru. Lakini sasa ile shida ambayo inatumiza sana ni vile hatuna uwezo wa chochote, na Kenya imejaa hiyo corruption. Hata kwa upande wa hospitali utaenda, pengine utaambiwa ni lazima utoe hivi na hivi ndio fanywe fulani. Kwa hivyo tuwe na, kama tungekuwa tuna uwezo wa kuwa yani tunapata support kubwa kwa hawa kama hao machifu, ingekuwa ni vizuri sana.
Asante Florence. Njoka, nilikuwa nimeona mkono wako, sijui kama bado ulikuwa unataka kuzungumza. I think she's dropped off. Okay, kama hakuna swali lengine ama comment nyingine, mimi yangu ni kusema asante. Hii ndio mara ya kwanza tumeweza kuzungumzia mambo ya ufisadi na haki za uzazi za wanawake walio na ulemavu, na sisi kama Disability Trust tunafikiri kuwa ni jambo la muhimu sana na linafaa kuangaziwa mara kwa mara. So leo tumekuwa na changamoto nyingi sana za mtandao, za link ilikuwa si ya tulikuwa na link 2 tofauti, so na confusion, watu wana join room hii kumbe ni room hii. So ningependa kuwaomba nyote msamaha, na kuwa pia ule wakati wa 1:30 pia nafikiri ilikuwa si inapaswa tuongeze, tukiwa na webinar nyingine au mkutano mwingine pengine tuweke masaa mawili, masaa mawili nusu pengine. So leo ni mara ya kwanza tumekuja pamoja. Pia sisi nafikiri tumepata mafunzo mengi kwa kuorganize hii webinar, na pia kuweza kuhusisha washikadau katika haya masuala ya haki za uzazi. So the next time, hii ni webinar ya kwanza, tulikuwa tunapangia webinar 3. Leo tumeangazia mambo ya ili swali Craig alikuwa ameuliza kwanza, what is corruption and what is the impact of corruption on sexual reproductive rights. The next webinar tutataka kupangia, na ningeomba nyote muweze kuungana na sisi, na pia tuweze kualika mashirika yanayofanya kazi katika sekta hii ya sexual reproductive rights, so that tuweze kushikana pamoja tukiangazia masuala haya, especially experiences za wanawake walemavu. Hizo lived experiences za women with disabilities, hizo ndio sana sana zina watu wana ignore ama they are invisible in mainstream SRHR programming ama policy. So nasema tena asante, natoa shukrani kama Disability Trust, kama timu yangu, na pia kwa speakers kutoka Tanzania, kutoka sehemu mbalimbali, sign language interpreter wetu, media officer Clarence, najua saizi ametoka jasho sana kwa changamoto zote alizopitia, lakini hivyo hivyo as I said, tumejifundisha mambo mengi, na mwezi unaokuja wa Oktoba pia tutaweza kuhost nyingine, na natumai itaenda vizuri zaidi ya hii ya leo. So asanteni sana kwa your patience, na tutatengeza report ya mazungumzo yote haya, na recommendation zenye mumetoa na pia mipango ya webinar ya pili na ya tatu, na nyote mutaalikwa katika festival yetu yenye itakuwa wiki ya mwisho ya Novemba, mahali ambapo tunakuja pamoja tukipaza sauti katika masuala ya SRHR. Na katika hiyo hali ya kupaza sauti tuna policy recommendations 3 zinazoangazia mambo mengi mliozungumzia, na data collection ni moja yao. Tukiangalia Ministry of Health hapa Kenya, ukienda hospitali huwa hawakuulizi kama hawa collect data on disability
kabisa.
Na ukiwauliza ni kwa nini, wanasema hiyo ni kitu it's a policy issue, so ni kitu kinafaa kitoke katika ofisi za Ministry of Health. Wao kama hospitali hawana uwezo wa kubadilisha na kuensure kuwa they are capturing data on disability, na tunajua kuwa bila uwezo huo wa kucapture hiyo data, then hata kama kuna shida yoyote ama budget allocations zozote hazitaweza kuangazia mambo ya ulemavu, kwa sababu ile data hakuna from the very beginning. So katika policy advocacy zetu, recommendations zenye tunataka kutoa kwa Wizara ya Afya, moja yao ni hiyo data collection. So na waomba nyote tuweze kuungana pamoja, kwa sababu huu ni mradi ama ni masuala yenye hayawezi kufanywa na shirika moja peke yake. Lazima tuungane sote pamoja na tuweze kuangazia masuala haya. Otherwise nasema asante sana. Asante sana kwa kuweza kukaa mpaka saa hizi almost saa 10:30 kuanzia saa 8. So asanteni sana, na tutawasiliana zaidi kwenye simu, kwenye mtandao, kwenye email. Asanteni.
Karibu. Haya, hata sisi tumeshukuru sana. God bless you.
Bye bye.
Amen. Craig, how are we closing?
Asante. Thank you so much. Asante sana. Tungependa
Alafu Craig,
yes,
kabla hatujamaliza, ripoti ya this time ni ya 5 ya Septemba ama ni first?
Hiyo mambo yetu ya mama siri tutaongea kesho kwa
group kesho.
Tungependa
tunaomba hatukuanza na maombi, lakini pengine tunaweza kumaliza na maombi.
Tunamaliza na maombi.
Tungependa kuomba labda Shela tuombee na Tohida. Shela, you can give us the Christian prayer, and Mama Tohida, you can give us Kiislamu. Asante.
Tunaomba. A'udhu billahi minash shaitani rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alamin. Arrahmanir rahim. Malik yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Amin.
Amen. Shela, uko bado na sisi? Please give us a closing prayer. Asante.
Yes, I am. So thank you so much, and it has been such an amazing. Let us believe and pray. Heavenly Father, I come before you this beautiful evening. We thank you for the engagement that we've had. We thank you for the time and dedication and contribution from the participants, and even Disability giving us this opportunity to discuss what we've been able to discuss, and the recommendation that we've stated, each one of us. Lord, be with us, guide us as we advocate for more our awareness on sexual reproductive health and our rights, and Lord, lead us and let us be a blessing to our own community of women with disability. For it is in Jesus' name we pray and believe. Amen.
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 Amen sana. Thank you.
Thank you.
Bye.